My name is Brandy Butcher, and I will be doing activity 4 of Sim 499, Project Objectives and Strategies, for the BSN SimPath program at American Sentinel University. So I want to start off by saying my capstone project is nurse burnout and compassion fatigue. So according to an article that I found on ProQuest Central, it defines burnout as the most commonly defined syndrome of emotional exhaustion, depersonalization, and reduced accomplishments that can occur among individuals who do people work of some kind. Some things that can lead to nurse burnout is work-related attitudes, especially in the ER. You tend to work with a lot of chiefs. We are highly specialized in a multitude of things, and sometimes we get a complex that we tend to think that we know everything and that we are better than other people. There's always a saying, nurses eat their young. That's absolutely correct. I have been to some places that treat new hires, new nurses, or people that just haven't been there a while very badly. So definitely the people you work with can cause that. Work or organizational environment. If the hospital, or actually any setting that you're working in, is a toxic environment, you're not going to want to come to work. It's going to create anxiety, animosity. You're not going to put in the best performance that you can do. You may even start to call off and not even care the consequences. And then the patient population and what you work with. So nurse burnout and compassion fatigue definitely affects ER nurses, but it affects all nurses, I think. Whether you're doing ambulatory care, hospice, home health, any med-surg floor, we get sick patients. We get patients that have no regard for their health whatsoever. We get patients 2 and 3 times a day, the same patient, 2 or 3 times a month, and it don't matter how good of a nurse that you are. It don't matter how much teaching and education that you have done with these patients. Some of them still are not the most compliant patients, and they come right back. It's disheartening and sad, and it's hard to grasp sometimes. So all of these things can lead to nurse burnout and compassion fatigue. Some of the characteristics of a nurse that may be experiencing this is they become ineffective at work, not just at work. They become ineffective at home also, because if you're a nurse, you know that it's hard to leave your work at home. Whatever you feel and whatever your attitude may be, it may drag over into your personal life. Depressed, apathetic, and detached. After having so many losses and so many rough days, you become almost numb because you don't want to feel sad. You don't want to feel defeated. You don't want to feel like you're not good enough. So it's easy to get that way over time. Some objectives that I think would be good to help decrease the amount of nurses that have compassion fatigue and just generalized burnout would be, I think that we should have I think that the nurse managers of every single unit should meet with administration and upper management regularly and make them aware of the possibility that their staff are getting burned out or already burned out and leaving the bedside. I think that they should practice being available and be supportive to all staff members. A strategy to implement this would be to have administration meet with all managers once a week, at first to identify problems within the unit and how they can go about changing them. And then after plans have been made, it will be the responsibility of the nurse manager to implement these plans on the unit. And then after they have implemented the changes, they should still meet with upper management and administration at least once a month to review and make sure that the plans that they've put in place is working. If it's not working, then they need to do something else. You don't see changes without putting in work and putting in the effort. The other objective, I think they should offer employee therapy at no charge for the employee. Help them to have an outlet to be able to express how they are feeling and make sure they're aware that it'll be confidential and that it's safe for them to be able to speak open and freely. Some strategies to be able to create this: they should create an employee and family counseling center, have a dedicated building or area or office for this. Employ several different therapists that specialize in a multitude of therapies, such as marriage counseling, grief loss, just regular routine counseling, just be able to talk about any problems that you could think of so they can get the help that they need. Another objective would be to have time to debrief after having a difficult shift. Be able to discuss with your team how things went and how we could have done anything to have changed the situation or made it different. To implement these, I would suggest that the manager come and be readily available for the day shift and the night shift. The day shift, they could come, an hour early for work and stay an hour late for the night shift, or whatever works best for them, but just be available for both shifts. If they're unavailable, then the charge nurse could lead meetings to be able to debrief. I think that would be a huge help, instead of carrying it with you, to be able to discuss it and talk about what happened and if there was anything you could have done to change it. Motivation. I feel like the nurse managers should focus more on the positives instead of the negatives. Working night shift, I rarely see managers or administration. So unless something's wrong, I don't really hear from them that much. And the thing is, I don't hear good or bad in that aspect. Like, as far as if I've done something good, I don't hear that. But if they have a negative problem or something that I have done wrong, then I feel like I get thousands of emails. Or, I've worked all night and then 10 o'clock in the morning I'm getting a text message: you need to fix this on your charting. You need to do this. You need to do that. Okay, I understand that I may have made a mistake and that I need to correct something, but that should not be the extent of the only time that I hear from you. If you only hear the negative, then you're going to get discouraged, feel like you can't do anything right, and it's going to start to affect your attitude, which is then going to affect your work. And just some strategies to that. I think that you should just stop sending so many emails that only highlight the negative. Shine a light on the good and send more positive emails than negative ones. And the last objective that I have would be to celebrate each other. Go out of your way to celebrate birthdays, holidays, retirements, deaths, weddings, and births by encouraging each other to be there for each other and to celebrate the highs and to mourn the lows. You'll make a more cohesive team and it'll run better as a department. And how to implement this, I think that you could set up a bank account for employees to contribute money. So not everybody makes the same amount of money, so you don't have to contribute hundreds of dollars. If you can only afford $5 this week, well, give $5. If you get paid every 2 weeks, you can only afford $5 every 2 weeks, give $5 every 2 weeks. If everybody gave $5 every 2 weeks, it would add up over time, and you would have money to be able to do those celebrations. And then I think you should elect a couple people to be in charge of it and utilize the funds appropriately. Of course, somebody you're going to trust, and that way nothing will go missing. But I think if we could just institute these small changes, that it would make a huge impact on everybody at work. Thank you so much.